In a renewed effort to reform Ghana's health sector, the Ministry of Health has inaugurated new board for 6 key regulatory institutions. The move forms part of government's broader strategy to improve healthcare delivery, ensure safety and restore public confidence. The newly constituted board include the Mental Health Authority, Ghana College of Pharmacists, Allied Health Professions Council, National Ambulance Service, Traditional Medicine Council and National Blood Service. Health Minister Kwabena Mintah Akandoh said the appointments are timely, aligning with ongoing national health reforms. He raised key concerns including poor mental health care access, pharmacist shortages, ambulance delays, and under-regulated traditional medicine. He tasked the board to address these gaps, improve service standards, and promote collaboration across agencies.
We can no longer afford to treat mental health as secondary. Mental illness now affects over 2.3 million Ghanaians, yet only 2% of those affected receive any form of formal psychiatric treatment. It is a determination of this government to make Ghana a pharmaceutical hub. You cannot make your country a pharmaceutical hub without a strong and a vibrant pharmaceutical industry. And you play a very vibrant role here. Together, these 6 institutions touch every stage of care, from prevention and diagnosis to treatment and recovery, and your boards are not being called to oversee merely. They are being called to steer. The Ministry of Health will support you with policies, coordinations, and systems, but we will also expect results, because real regulation is not about paperwork. It's about protecting lives, building trust, and keeping the promise of health for all. So I encourage you, work across agencies, let data guide your decision, and above all, keep the Ghanaian patient, urban and rural, rich or poor, at the center of your mandate. This government will not tolerate lamentations and repetition of challenges. Yesterday I said it here. When we come for reviews and defense of our budget, after the review, they will enumerate now challenges of the institution. The following year, the same challenges. Subsequent year, the same challenges. It is usually indictment on the boards and those sectors. Leaders are put in place to solve problems. It is not going to be business as usual. Forgive me. We cannot continue to do the same thing and expect different results.
He also charged the National Blood Service to tackle the country's annual blood deficit by increasing voluntary donations. The 6 boards are expected to drive professionalism and equitable health care for all Ghanaians.
In 2024, Ghana collected just under 190,000 units of blood, but our national requirement exceeds 300,000 units. That leaves a consistent annual shortfall of more than 120,000 units. Even more concerning, only about a quarter of blood donations come from voluntary donors, a key indicator of a resilient blood supply system. This board must lead the push towards greater donor engagement, improved safety systems, and a culture where voluntary blood donation becomes a national norm.